Welcome to Local Legends with Jess, the Arizona edition. I'm Jessica Benevento, your mortgage matchmaker, opening doors with ease and bringing you the stories behind Arizona's most inspiring people. From best-selling authors and elite athletes to business badasses making moves across the valley. These are the local legends shaping our communities. Get the inside scoop, real talk, and powerful conversations you won't hear anywhere else. Local Legends with Jess, where Arizona's stories connect. Welcome to Local Legends with me, Jess, and my co-host, Jason.
Hello.
We got to work on that.
I know. I've been doing that.
I have a special guest with me today, Miss Marisa. Yeah, you're my local legend today. You're our. I have to.
He's included.
Yeah.
He's included now.
I'm like a footnote.
Come closer to me. Why are you so far?
I'm trying to be by the mic.
I'm just joking. So, special guest Marisa, you're a local legend because personally, actually, we could both say we've benefited from your services. We'll get into that. But before we get into that, I want to give a shout out to our sponsor, Justin from State Farm. He's a local agent here in Arizona, and he covers whole life, business insurance, car, home insurance. Anything else I'm missing?
www.myagentjustin.com.
Yeah. Wow. All right. You did good. Yeah. So that's our sponsor. He's awesome. And we want to give him a shout out. So getting right into you, Miss Marisa. Thank you for being here.
Thanks for having me.
Don't be nervous.
Okay, I'm not nervous.
I get nervous every time I do this.
I feel like you should have just told me the camera was not rolling, and then we should have done it.
I know.
And then we're like, "Okay, we're done."
Because it's awkward when you know there's a camera on you, right?
Yeah.
I know. But don't just.
Okay.
I only have a few followers. It's not a big deal. Right? So before we really get into what you do right now, give me how did you get to where you are right now? Like, where did that come from? Give me your background.
Well, that's a big question.
Okay.
Just
what did you want to be when
I grew up?
What did you? Yes.
I actually always wanted to be in skin or skin health because I had acne, and I'm like, I am figuring this out. Like, where did we go wrong? What am I doing wrong? And I wanted an answer for people. I went to nursing school because my dad said I couldn't become an esthetician. So he's like, you have to become something else.
Yep.
And I'm like, okay. So I went to nursing school, and then I met a dear friend who was an esthetician going back to school to do injectables. At that time, this was like 2012. I didn't even know what injectables were.
Right.
This is kind of when it was more of a secret.
Yeah. Yeah.
And people would say like, oh, who does your lips? I'm like, oh, it's MAC lip gloss with this color. You know, I had no idea what it was. Fast forward, got into bedside nursing for only 1 year and quickly realized that is not where I belong.
And what's that look like, bedside nursing?
I was on a neurotrauma unit
people that are sick,
at
right?
Osborne. Yeah.
Oh,
And
gosh.
I mean, it's gratifying, but I had little ones, and I was taking care of a lot of people with like traumatic brain injuries.
You take that stuff home with you. It's got to be difficult.
And you're like, God. My kids are never going in a car with anybody ever again.
Yeah.
That's got to be tough.
Yeah. So, but it was great. It was cool to see the good stories of, motorcycle accidents, and they come in and their jaws are wired shut, and then 3 months later they're walking out.
Right.
Oh, that's cool.
It was beautiful.
Yeah.
At times. So I did that for 1 year, and then I slowly went into aesthetics as I built my clientele.
Okay.
And so this is 10 years ago. And so I was doing the hospital. I was also a nurse at the Intel construction, the power plant.
Yeah.
I was the construction nurse.
How did that come up? Where did you get that job from?
I don't really know.
Is that like a no-show job?
I knew right.
I know. Seriously.
I went everything from like a splinter to a heart attack. I was like, I'm here, guys.
Was it tacos got into? It's indigestion.
I know. And then another guy's like, I have acid, like taking my hand off. So, and then some days I would go 12 hours and not see anybody.
Yeah.
So anyways, it was a great job because the hours I could start at 4:30 in the morning.
Okay.
And then I could get the girls after school.
Yeah.
But anyways, I did those two jobs while I was building up my clientele as an injector. And then as my clientele grew, I was able to let go of those other two and then fully devote to aesthetics after about a year.
Okay.
Doing all three. And then fast forward a few years, maybe about 6 of them, I realized I think this industry is going to have a little bit more ruling or legislation with it. And so I felt the push to go back to school to become a nurse practitioner because I knew fast forward, we may have to have a medical director overseeing everything that we do as nurses. And so in Arizona, you have full practice authority as a nurse practitioner. So I went back to school strictly just to own my own practice, be my own medical director.
So cool.
And then during that process, you have to do clinical hours. And so I was able to do roughly 700 hours with a medical doctor and just be at like the forefront of our healthcare and look at what it looks like and how we're treating people. And I really saw a huge disconnect. And not that he wasn't brilliant. I think he's like one of the smartest people I've ever met in my life. But I think there's a big disconnect between Eastern and Western medicine. Yeah. And then peptides became really hot. So I started looking into peptides and then realized the missing piece was understanding hormones. Yeah. So all that has led me to Mode, where my business partner, Heather, and we have opened the practice together. In July, it'll be 2 years that we've been there. Yeah. Awesome. Our baby will be 2. Yeah. Wow. And we offer injectables, hormone optimization, peptide therapy. We're rolling out IV therapy like methylene blue and detox IVs, really cool stuff.
Do you do the methylene blue?
I haven't tried it yet. I literally just picked it up last week, and I'm really excited. We were just getting all the supplies. Right. Have you guys tried it?
Yeah, I have. Yeah. So you know what's so funny? You see, it's a social media world, right? Yeah. And you see guys like dropping it in their mouth. And I'm like, I'm reading everything, and I'm like, I think we'll do water. And then after a while, I'm like, I don't really feel it. So now I'm like dropping it. My whole mouth looked like I just ate blue ink.
It was so
for all day. And I couldn't get rid of it.
All day. I was like, you can't do that. Like, you got to like drop it in your or IV. I think IV is going to be the best way to do it.
And then Jess, I'm like, Jess, one of the ways you could tell if it's real is if your urine's blue. She's like, I got blue urine.
Screaming from the bathroom.
My kids are like, you guys are weird.
I felt like I only did it once, but I definitely felt a jolt of like clarity, energy. And I'm like, is this just poison? And I'm just like,
good poison.
It was like, literally, good poison, I guess. But what are the benefits to it?
I'm excited. Well, we're just bringing it on now. Okay. So to really help bring more oxygen to your red blood cells. Okay. And so that can get delivered throughout the body better. And then overall cognitive benefits. Right. So people are doing it for longevity to lower inflammation and help improve cognitive improvement.
Yeah, I felt something.
You know, you got to see. You got to see Mel Gibson. Did you see that on Joe Rogan?
I love him.
And he's a little. I like Mel. Either you love him or you don't.
Oh, I like Joe Rogan.
Yeah, I like both of them a lot. But he said, you just watch it because he's like methylene blue and a bunch of different things helped his friends with cancer and they're cancer free.
Oh, yeah, that's right.
Remember? Yeah, you got to see.
It is interesting where people are going. Yeah. Like, I'm actually not scared to get cancer if I get it. I feel like we all know what we're doing. Right. You know? Yeah. And it's pretty fascinating where I think it's such a fun time to be in medicine.
Yeah, I do too.
And I love how, so I'm going to glaze you. Oh, I glaze my guess. I love how I've never been to someone. So let me rewind and tell my audience how I met you. Okay. I was introduced. So I have a friend.
It always goes back to her story.
Yeah, it does. That's I like it. She's a guest relatable. On here. Yeah. Well, I had a friend that I ran into, and she was like, I'm out of control. And she's older than me. She's like, I'm out of control, like sexually. Like I'm so around. I'm like, oh my God, what are you doing? Because I've done the hormone pellet before, and I feel like my body probably just got used to it, and I didn't feel the crazy effects. And this animal, as you know, is now on testosterone. So it's like to continue a good marriage, I feel like you have to be on the same page, or he's just going to go and find someone.
You have to.
And
I know. I told my husband, I was like, I think I'm saving marriages. He goes, well, you could be ruining them.
No.
And I'm like, what do you mean? He's like, well, what if one person? Yes. And I was like, you're right. Yes. You need to say, you both need to come in.
Yes, exactly. Like you have to consult. Like that should be your first.
Well, you know what it is, to be honest with you? And you are actually saving marriages because like I love my wife, right? But as a guy, we're kind of like animals in some way, right?
You really are.
And it's like when a guy wants to do something with his wife and his wife is like, no, I'm not, I don't feel it. You kind of feel like you're like turned down as a little child.
Yeah, of course.
And I'm like, I've been doing push-ups, I'm working out. I'm like, what don't you see? And then it's not even like that she doesn't love me. It's just that she's tired, right?
Yeah.
But I'm like, you got to untie yourself. Yeah. Like, there's only so much I can take it. I'm like running around dragging my knuckles.
Oh my gosh.
Like, I'll do the dishes.
Yeah, I did. I started doing the dishes.
I was like, that works.
I'm cooking. I'm like getting stews. I'm making ragu.
You just need to clean. Just clean, make beds, put your clothes away. I mean,
She's
it's
like,
very easy.
She's like, honey, I'm coming home. Show me a picture. I'm like, okay. Yeah. And it was that I did the laundry room. It was a picture.
It was a turn on.
And that really is a turn on.
Yeah.
It seriously is.
It was. I swear to God, I'm like, oh, that's
did I do
so
it?
amazing. Now I
Yeah,
showed all
a clean
my
house to
friends.
us is like you guys getting like a bikini picture.
Yeah.
Or something. Or like,
it's so true.
Yeah,
Yeah.
like when the cleaning ladies leave, I'm like, okay,
It's
I
the
feel
best
good.
feeling
Yeah,
ever.
we're
But
good.
see, that's the thing I don't get. Like, we have to really clean before the cleaning lady comes. I don't understand
I do
that
too.
concept.
I do too.
She's like, she's not here to do everything.
She's not, no, what I say, and I don't talk like that, I say she's not a maid. We don't have them. If you want a maid, you have to pay for a maid. We have a cleaning lady. So get your shit out and let her clean.
I like
She
a
doesn't put your
document of
stuff
what it is
away.
that she cleans and what she doesn't. That's all I need.
Floor. She makes things look nice.
Yeah,
but if you have a
do a
bunch
good
of
job.
shit, she's putting a bunch of shit nicely away. Like, no, you put it away. Anyway, we are off topic.
What about laundry? I did laundry.
All right.
Wow, you're kind of a dream.
Yes.
So he's done it once in like 15 years.
He's like,
Don't
he
put me
literally
down.
switched to the
just did
load.
it. Yeah, yeah. Okay.
That was my moment to shine.
You did shine. Good job. So back to how I met you. So my friend is like, oh my God, I'm this, I'm that. I'm like so turned on. I can't even handle it, blah, 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 blah. And I'm like, oh, I got to get back there because I was there at one point with my hormone therapy with the pellet, but I
Must have been with her boyfriend.
No, it was with you. I told you this. Anyway, I'm going to go back. So I was like, oh my gosh, give me her number. And that's when I called you. I came in, but this is where I'm going to really glaze you. I came in beautiful. You have a beautiful office. And that right away, I mean, if you're going to go in and you want to feel good and look good, like your aesthetic is on point. So you're that's beautiful. And that already said like.
You ruined her for all offices moving forward.
Oh yeah, So that was beautiful. But you actually sat down with me and really was like, tell me everything. Like what's going on? And even though I was on the hormone pellet and whatever, you just, it was like, okay, that's in the past. We're going to start from zero. And it's not like you just injected me with stuff that I've already been taking. Like you actually had blood work done.
But I think you enjoy the story just as much as the medicine,
she
which
really,
is, but that's why you're good at what you do.
Yeah,
and I think that's so cool.
Yeah. It was so cool. And I think I had said to you at one time, like, I want to get back to that feeling with the pellet. That one time when I first got it in, I remember driving and there was an 18-wheeler next to me and this very unattractive guy. And I was like, I swear to God, I'm like, oh my God, it works. Now I know how it is.
Nothing like the first high.
That first.
There really isn't.
Freaking high.
That's every truck.
I guess. Right. But
true.
I want to get back there. And Marissa's like, okay, I don't know if I could get you wanting to have sex with a truck driver, but I will do my best. But
she said she could, but I had to sign off on it. I was willing to sign
I do have to call the spouse.
Exactly.
So we have limits.
Exactly.
There's only so much we can take.
I know. So I got all excited. So I get blood work and we go over everything. And literally, I mean, you wanted to know everything. And it's just, I'm on Lexapro, obviously, to deal with my husband. That's why I got on that antidepressant, anti-anxiety med 15 years ago. But Marissa's like, we got to get you off that. Like, we're going to really go slow, but like we could do natural things to get you there. And I just love that you really, you could tell you really care. And I love that. And and I'm sure.
No, listen, you've done wonders. Don't get her off the Lexapro too quick.
Well, remember
baby steps. Baby steps.
Wait, I did stop. Remember I told you, like,
she stopped it once.
I told you not to
She's
do
like,
that.
did you shut the refrigerator?
I did.
I caught a knife thrown in my head.
Yeah, she did exactly what I said don't do.
No, that's exactly her.
But
all
that's
she heard was get off Alexa Pro immediately.
That's okay.
I know. When Marissa said we're gonna wean you off slowly, I was like, I could handle
like,
this.
out the window.
Yeah.
I'm
She's
good.
trying.
And I was like,
it's a 101.
Yeah.
Alexa Pro pills for getting drugs.
Yeah.
But anyway, it's been a wonderful experience so far,
I'm so
and I
happy to hear that.
want to share you with people because, again, I've been to doctors in the past, and it's you really do care, and that's how I run my business. And again, like I had said in our other episode, I really like to be at this age and be able to surround myself with people that are alike. Like I just that truly care that their business is not just a job, it's an actual career, and you want to help other people, and that you get excited to help other people. Like, I don't know if I should, you text me back. Like, that's not normal. A doctor doesn't text someone back. Like, that's, thank you for that. And I know I annoy you on the weekends.
You really don't. I actually love when you text me. I love it. I'm like, hold on, babe. And I'm just texting you back, or any client, really.
Jess is at a truck stop. What is going on?
I just saw her location.
Been there for 26
She
minutes.
just drove past me. I was driving my son to baseball. She was in a truck.
It's crazy because I'll never forget that feeling, looking up and I got like the tingle.
Yeah.
You know, the tingle. But I didn't do anything, so we're good.
Oh, gee, thanks, Jess.
Okay, but going to, besides the hormone pellet and the hormones, tell us about peptides, because that is such a huge, like you said, such a huge topic.
It's such a buzzword. It's such a hot thing right now.
I get excited injecting myself. I don't even know what I'm really doing, but it's kind of fun.
My son's like, Dad, I was getting the butter and a syringe hit me in the top of the head.
Oh my God.
Tell us about the peptides.
Well, when I was looking into peptides and learning more about them, and I think too, everybody is so much more educated today because of social media.
Yeah.
Right.
So I have a lot of times people come to me and they're like, I want to try this. I'm like, oh, I've actually never heard of this.
Yeah,
so please let me look it up. Give me a few days and like educate myself.
Yeah.
I love peptides. Peptides, think of them as signals. And so the reason why I went into understanding hormones was because peptides are signals, but hormones are like the environment. And so if your hormones are off or not balanced or declined, these aren't going to operate as well.
Oh, okay.
And so I felt like, not that they don't work, but just not as well.
Right.
And so anytime somebody would come in for peptides, I'm like, okay, well, where are we at with our hormones?
That's why it's important to get blood work.
Metabolic health and where, how's our diet? How's our lifestyle? How's everything? Because we used to tell people you can't out supplement a bad diet.
It's true.
You can't out peptide, a bad lifestyle or just an aging human.
Right.
But I think they're great. I love them. I think we know like maybe 10, I feel like, that are floating around on social media, but there's thousands. And so it's a really cool part of the industry that is growing, that will get a lot of attention. We did just release, I think, 12 more that are going to be more readily available.
Really?
And they were removed from the category 2 list.
Okay. So wildly enough, Gina, my friend Gina, okay. I went to lunch with my girlfriends the other day, and I haven't seen the one in a while. And I'm like, oh my God, you're so, did you just get a spray tan? Like, she was a little tanner.
Oh, the melanoma.
And she said peptides. I'm like, no way.
She's like, you take a tiny bit. And I went in the sun in March.
Great?
I'm like, March. She's like, that's it. I'm like, you look like you just got off a yacht.
I know.
Like, it's insane.
Great?
Yeah. It's crazy.
It is crazy.
That might be my next one.
So here's a question.
So tan.
I just went spray tan. But like, I would, sometimes I'm
So that one
orange.
was on the list.
Yeah. Oh, okay.
Yeah, so that's going to be more readily available.
I'll try it.
Here's a question I got.
I'll inject myself.
So now people are readily like educating themselves.
Yeah.
And people are buying it on their own.
Yes.
Right. But then again, you don't know what you're buying, right?
Correct.
So with you, I'm assuming, right, everything you get has to be like top-notch stuff, which is so important.
Yeah.
Yeah.
There are 3 compounding pharmacies that I feel safest with. One's in Texas, one's here, and one's in Colorado.
Okay.
They all offer.
All in the U.S.
All in the U.S.
Yep.
Yes.
Yep. There are other. So I don't think research peptides are bad, but I don't feel safe enough to prescribe them to a patient.
Yeah.
I might try something and put something in my own body.
Yeah.
But because it's not, regulated yet, we don't really know what the dose is. We don't really know.
Is BP 157 regulated?
BPC 157.
Yeah.
What's that one?
Yeah, that one.
It's like a recovery drug. It gets like a Wolverine.
Yeah, it is great. That one's amazing. You can take it orally too.
Yeah.
So my daughter, she suffered, she had ulcers.
Okay.
And so you could take it orally and basically it will heal everything from hole to hole.
It's
so healing. And with KPV.
I was, but I didn't like the fact that it gave me black and blues in my stomach. I was walking around.
It's like hold pressure.
Yeah.
Hold pressure after you inject
Is that, I don't mind. Throw up.
Do you have to take them in your stomach?
No, you can do your stomach. You can do the top of your glute.
Your retina.
You can do the back of your earlobe.
No. Can you really take them in your ear?
No, I'm just kidding.
I walk around like an earring.
Oh my God. The back of your arm.
Okay.
Or it's kind of painful, but the top outer part of your thigh.
Oh, really?
It's like
painful
when you're bored.
Me,
you're like,
but I've tried it. Yeah.
Try it.
Yeah. I think our glute, we have a lot more cushion back there.
Oh,
you can do like the top of it right there.
Okay. But is there a spot that hits better, like for overall feeling?
It's all going systemic.
Okay.
But it's funny because I used to think people were crazy for saying this, but Dr. Neil Rouzier, I was listening to a hormone conference that he was hosting, and he was saying for men or women to give their testosterone in their thigh because there's more blood supply and there's not as much blood supply in your stomach tissue. And I was like, oh my gosh, there is something to this.
Yeah.
Right.
So I tried the top thigh and it hurts and I bruised, but I'll try it again.
Okay. That's great.
Yeah.
Okay. Your favorite peptides right now that you personally give? Yeah, or take as well.
I love growth hormone stimulating peptides. So those are going to be your sermorelin, ipamorelin, tesamorelin, or CJC 1295.
Okay.
One of the pharmacies that I get from, it's compounded together, the CJC, ipamorelin, and sermorelin. So having like growth hormone in your body, elevated growth hormone, is linked to just overall longevity. Better
wellness,
health, better everything. Okay. And so that hormone alone with testosterone, estrogen, and progesterone, I feel is just as important.
Okay.
Yeah.
Is that injected too? That's
the same you would inject that 5 out of 7 nights a week.
Okay.
And you can cycle that. Some people say you never have to come off. I always say like maybe take a month break and then you can go back on it again for 3 months.
Should I be on that?
We could try it. Helps with insulin resistance, helps with better sleep, helps with muscle definition. A lot of people think they just need to be on tirzepatide or semaglutide or retatrutide, which it's great. Those are awesome. But for long term, we need to think about our muscles, our bones, like everything that we're losing. And so the growth hormone stimulating peptide helps put on muscle, helps lean mass.
Yeah. Sleep, right?
Sleep, recovery.
Actually, hair too. The thickness of hair.
Okay.
Yeah, all of it.
So let me ask you this. I guess everybody would be cool, but I think it would be cool for you, like if you had somebody that like really did not feel great about themselves, like maybe a little overweight, insecure, and for you to take that person from point A to all the way to like them feeling wonderful about themselves, it has to be like, have you done anybody that's like from point A? I know Jess is like S, like she's getting there.
Okay.
Right? But I'm saying like but
when we have sex 3 times a day, I'll be there.
No, not even that.
Probably.
Here's a compliment to you, but you're not starting from zero. Like you were really good when you saw her originally, but I'm talking somebody like all the way to the left.
Okay.
You know what I mean?
Yeah.
Yeah, like starting from ground zero.
Right.
Yeah.
You know, you might have family members like that.
Is an injector. And so all the time I can do injections in somebody, and my favorite clientele is like 40s, 50s, 60s, because after we've done, a huge treatment and they're in my chair for 2 hours and I give them the mirror and they get tears in their eyes because they're like, I look like myself again. Yeah. And it's so rewarding. But now after going through school and understanding hormones, it's just like that because now they feel better.
Yeah.
So it's like you feel good, you look good.
And film it.
And like do film like a before and after.
No, like a journey.
Yeah.
Like because people like to be like attached to somebody's like win, right? And you're seeing this person, it's a win for you, and it's a win for that person. It's actually just a good story.
Yeah.
And you take somebody from A and like not feeling great to a true story at the end.
That's a total.
That's
maybe somebody in your family.
Can I get a sample patient?
You're such a jerk.
No, that's
why don't I get off everything? Everything.
Oh, let's
and
go
come
to
in
zero.
like a mess.
Listen, could we cage her for a couple months? She gets off everything. Last time she did that, she had a goatee, and she,
Oh my God. No, that's from hormones. That's why I have to get laser all the time.
she started speaking like she was from the cartel.
I did have to tell my husband that the other day. I was
Yeah.
like, hey, you know what? Like when we're driving, if you ever see anything, like
Make sure
you have
you
to
tell
me.
me.
Like he's like,
Yes.
why would I see something? I'm like,
Yeah.
because I just started testosterone.
Yes, you're going to
He's
definitely
like,
see something.
For sure.
Yeah, I have
For
to shave
sure.
my face.
But thankfully,
Not
we do
anymore,
laser
though.
hair removal at the
Yeah, thank
office.
God.
Exactly.
Yeah.
Right.
Jess had a mustache one day, but like a full one. It was like a 5 o'clock shot.
No, I didn't. I get rid of that.
believe
I've
you.
been doing hair removal for probably since my son was probably a year old, like 13 years
Yeah.
off. Because
Well,
of
we're Italian also.
oh my
which
gosh,
is-
I know.
Yeah.
I know. Okay, go back to the treatments that you do in your office.
Okay. So Heather is my partner, and she does all the aesthetic side as far as like facials, dermaplaning, lasers. We have a BBL Moxie laser that is
for like peels.
amazing.
Yeah.
Yeah,
Okay.
peels,
Yep.
all the skin health, get you on good medical grade skincare regimens.
Mhm.
And then my side of the practice, it's myself and Tori, and then we do all the injectables. And so dermal fillers, regenerative medicine, we brought on human biologics, which is really cool.
What's that?
Because so I don't know if I can say this or not, but I'm gonna say it.
Okay.
So have you heard of PRP or PRF?
Yes.
Yes.
Okay. So that is injected. It was started like in joints, helps with healing, stimulate collagen, tissue repair. So we put that around the eyes or around the mouth.
Okay.
Now, fast forward, we met a doctor at Aesthetic Next in October who got on the panel or on stage, and he's been studying pure amniotic fluid and cells from the placental cord
Right.
for the last 20 years. And he has been studying regenerative medicine and its benefits. With that, they're doing an FDA clinical trial right now with IV therapy for long-term COVID patients.
Right.
Extremely safe. They've had 0 complications. And it's all from healthy C-section deliveries. And the moms are third-party tested, babies are third-party tested, DNA is removed from the amniotic fluid.
Okay.
And so we're left with 350 billion exosomes, growth factors, cytokines, clotho-protein, like everything you need to grow a perfectly healthy human, we use to inject under the eyes and around the mouth.
What?
To
Sign me up.
I know. It's amazing. It's
Yeah.
amazing. We apply it topically after getting lasers, and it is wild how you immediately feel like the burning pain is just gone.
That's
Yeah,
crazy.
redness.
It's almost like stem cell.
Almost.
Right.
Yeah.
Yeah, but they're exosomes,
Yeah.
so they're messengers.
Yeah.
Yeah. Yeah.
That's another thing that's amazing if you read up on stem cell.
Oh, I know. I want to
Yeah.
fly to Panama
Yeah.
and I
mean,
want to
it's-
get it done.
Yeah.
So bad.
Yeah. It's amazing. But
Okay. Can I do that around my?
Yeah.
This is what I need, and
We
this
can
is
do
what
all the
this is why I
things.
get my makeup and hair done because I hate what I look like on camera. I'm so loose right here. What could you do, or is this a mini facelift?
I
Why
mean,
are
we
you
could
laughing?
do a facelift, but I would say support the frame of your face. So like temples, lateral jaw, and
What
maybe
could
a
you
little bit in the piriform would help you.
Injecting me?
Yeah.
Okay.
Yeah.
Call you tomorrow and make an appointment.
Okay.
Since we share accounts now, I just if I look better, I'll feel better and I'll want to
yeah.
have a lot of sex.
Yeah, it's a good one.
Exactly.
There we go.
Exactly.
Well, thank you so much for being.
Thank you for having
here.
me.
Okay, give your plug. Where can we find you?
Well, I got one
How
last
can we get in
question.
touch
what
with
is it?
you?
One last question.
Yes.
What?
In your practice, is this the most that you've
You're not-
seen? I'm sorry. In your practice, has your male clientele jumped?
Oh yeah.
Because I feel like males are now being more aware of things online, like using skincare products.
They are.
So has your
Absolutely.
has
I would
your
say
patient-
20% of our practice is male.
yeah, and
It
that,
is growing.
Yeah.
Especially now that we offer hormone replacement
Yeah.
therapy.
right.
But then them walking in the door, knowing they're going to get hormone replacement therapy, them seeing the skincare and the treatments, they're like,
Totally.
oh, wait, could I laser my back? Or
Right.
what could I do for my wrinkles? I think people are just,
Yeah.
they're more open. It's not just a girl thing.
yeah.
Yeah.
I love that.
So go
human
ahead. I'm
being.
sorry for jumping in.
Well, I asked Marissa to plug
Oh,
herself.
you can find us, our website. We're working on it right now, but It's modescottsdale.com because nobody knows how to spell aesthetics. And then,
definitely not.
Yeah. And then my Instagram handle is, I should change it. It's a little hard. Aesthete, AESTHETE _ Marisa Dulan.
Okay.
So if you just type my name, I think you'll find it.
Yay. Thank you for being on here.
Thank you for having me.
You rock. Thank you.
That was great.
That's a wrap.